Hello, I would like to talk about empty nose syndrome today. So, there are a lot of patients sending us messages via WhatsApp, internet, or other communication routes about empty nose syndrome. What is empty nose syndrome? Empty nose syndrome is the loss of function of the nose. There are some structures on the lateral sides of our both nasal cavities, which we call turbinates. Their function is very important in nasal physiology. They humidify, adjust the temperature, and clean the air coming inside, and it filtrates the air going to the lungs. So, if any harm given to these structures during a surgery or some kind of drug use like cocaine, the function of the nose may disturb. So, what do we do in these kind of patients? If there is an anatomical problem, for example, if the turbinates are resected or if there is a septal perforation, we have to reconstruct the resected turbinate or we have to repair the septal perforation first. After all these repairs, if patients still have functional problems, these are because of the loss of some cells in our mucosa. For example, there are two kinds of cells secreting the mucus. One type of cell secretes the watery part of the mucus. If there's a loss of these kind of cells, which we call soil layer of the mucus, we have to reconstruct them too. How we can reconstruct them? We can use stem cell therapies. For example,
Stem cells which we harvest from fat tissue.
after harvesting fat tissue, we ultrafiltrate the fat cells, and there is stem cells left behind, and we inject these stem cells to the nasal turbinates, which causes the function to come back. Sometimes other kinds of treatments, PRP, or some kind of medical therapy also, like humidifiers, some ointments, some kind of different chemicals may help. But the most important thing is to reconstruct the aeration of the nose, reconstruct the laminar flow as far as possible, reconstruct the resistance, so the patient can become much more physiologically adapted to air coming in. And after that, we are going to use stem cell therapy in order to increase the function.
So these are what we do in empty nose patients.